Hi everyone, and welcome to the first story of the Healing Diaries. This story is about a 70-year-old patient, a very special patient to me. Now why she's special I'll tell you at the end of the video, but let's start with her story first. So she came to my clinic with severe pain in the entire leg, so much so that she had difficulty in even walking from the door to the chair. So I had to actually assist her, make her sit. And then I went on to taking a history assessment, and she had a radiating pain down her leg. And then, as usual, I asked her, what are your goals? What do you mean to achieve at the end of the treatment? And I expected her to say things like, I should be able to walk properly, or I should be able to cook properly, take care of my grandchildren, or now that I've retired, I want to go on trips. Usually what people around her age tell me their goals. This patient, however, said just one thing. Doctor, all I want to do is to be able to take care of my dog. I've not been able to feed him. I'm not able to take care of him, or give him a bath, nothing. Right now my husband is doing all of that, and I'm not very happy with the job that he's doing. And then she went on to tell me the story that you'll be surprised why I'm telling you so much about my dog, but you need to understand that right from when I was a child, I have never known a life without a dog. At my parents' house there was a dog. Then when I got married, there were two dogs. There were three dogs at my in-laws' house, and now after so many years also, today right now I have an 8-year-old dog who stays with me. His name is Golu, and every morning I get up, I give him food, I sit with him on the floor for some time, I even read to him. And that's all I want to achieve. And the reason why this patient is so special to me is because this patient was my very first patient at the beginning of my journey as a clinical practitioner. And this is 2012, so I was just 24 at that time. I was still doing my masters. I used to go to an ortho hospital. There was an OPD there, and he used to see their patients for 2 hours. One day my senior physiotherapist was not there, and she told me to handle the OPD. That's when this patient had come. So she was my very, very first patient that I've handled independently. And at the beginning of my journey, she reminded me that healing and improving is not just about achieving some milestones, or just being independent, or it's not even just getting rid of the pain or improving the muscle strength, improving the movement of the joint, but looking at the patient as a whole, and understanding what is affected, what part of their life is affected, and getting back to those small routines, to living basically how you used to live earlier. So yes, that was an important learning for me today. It's muscle memory. Sometimes you don't even think about these things so much, but back at that time it was a big revelation ki, oh yes, this is something that I should be looking out for in every patient. And that's why today people sometimes ask me, why do you know so many personal details about your patient? And that's the reason, because the field that I am in, I need to understand what exactly the patient does, what exactly he likes, dislikes, in order to get them better completely.